In the early summer, Mr. Diego Javier, age 56 year, an obese, a part-time off-a-goer and a part-time long-haul licensed motor vehicle driver is depressed and anxious. He is a chain smoker, takes regular alcohol and is irregular at his work. He lives with his wife Sienna, in the house owned by Alejandro and his common-law partner, Esmeralda, his son's family in Revelstoke. Sienna has bilateral osteoarthritis and moves with assistive devices. He does not have a family GP and does not follow medical appointments. His office colleague, who is extremely careful about maladies, tries to help him with some health information on the fly. Javier is detected with high blood pressure and type 2 diabetes mellitus over the last 6 years when he injured his left toes in a minor motor vehicle accident 1 year ago. Diego has had recurrent hospital admissions over the past year. He has been managed for chronic non-healing left foot ulcers and referred to a home health care. Recently, his left lower extremity is extremely rigid, discolored, had open wounds and he cannot independently perform his activities of daily living. He has had uncontrolled blood glucose and unrelieved foot pain, and the family has decided to seek supports from the local community resources. Lori, RN, and Kate, LPN are frontline health workers at the Eternal Community Health Center in the heart of Revelstoke and travel for managing clients with chronic illness at home, in assisted living and residential care. They have planned home visits for their clients and families today and are planning to go as a team to visit Diego Javier at his home.
Good afternoon, we are from Eternal Community Health Center. We will do the assessment, your care, and provide the necessary education for you. Yeah, well, my husband should eat and should be supported with his movement.
I feel overwhelmed and too tired to do anything. I cannot walk, my foot feels pain when moving and trembling. I cannot drive my truck.
I help him with his bathing. So, we want my dad to be able to move again, walk in the park and go to work.
May I check your blood pressure and do an initial assessment?
Yes, please go ahead.
Your vital signs show a normal temperature of 36.7 degrees Celsius, pulse 90 bpm, and BP 150/106 mm Hg with a little drop when you sit up. On examination, your lungs were clear, the heart was fast, but I didn't hear any murmurs. You have a kind of quiet abdomen, right-sided tenderness, and no swelling. There was tenderness, increased warmth, and pain on your left foot. Well, it's obvious you have an infected foot ulcer and an open wound. You may need antibiotics and adjustment of your insulin dosage. We will call the nurse practitioner and discuss your care. How much was your last weight? And how much is the blood sugar?
A week ago his weight was 165.3 pounds. Doctor said his blood sugar increased to 200 mg per dl. In the past he has a varying blood sugar between 125 to 250 milligrams per dl. He was critical and taken to hospital recently. He has a very large appetite, but I limit it. Ha, ha, ha.
What do you think could have caused your blood sugar to be at this level?
Oh gosh, I forgot to take my insulin today morning. I eat a lot and I do not exercise.
What are some things you can do differently so your blood sugar does not get too high?
I can watch my carbs and reduce my passion for pastries. Oh dear, who am I kidding? I cannot control my eating.
The RNS show Diego and his family the first 2 videos from the educational resources. They talk about adherence to the insulin regimen, increasing his insulin dose, and the effect of last dose in the day. They discuss his fluid status, especially with diabetes when he is sick, for increasing hydration. They take a look at the wound and observe the wound bed. They discuss a realistic plan of care based on Diego's willingness and readiness to learn.
You know, the management of diabetes can be quite challenging. You do think he has a diabetes foot infection? There are several things you need to think about, especially in regard to insulin.
Changing my insulin regimen is particularly difficult since I did not have diabetes in the past.
Infection causes an increase in metabolic rate, and a need for an increase in insulin requirements in your healing process.
Your reasoning makes sense to me. I will watch my diet and check my sugar.
After Lori and Kate conduct an assessment on Diego, they discuss and teach Diego and his family about diet, exercise, medications, and wound care. They engage his family in participating in his self-care management goals. Lori and Kate participate in educating him about diabetes foot care. Diabetes foot care helps to prevent injury, support blood circulation in the legs, improves muscle strength, and overcomes limitations of motion.
Diego, we have discussed with you the plan for care. This educational resource will teach you and your family the basics about caring for diabetes and will remind you what you need to do for your activities of living.